skincare products, some of the aesthetic services we offer today, and we will be doing a lash lift demo at the end. Please hold off on any questions until the lash lift. There will be 2 times when we'll be having some processing, and at that time we will answer any questions you may have. Today you have myself, Katie Dion, and Kate Connor, and we are thrilled that you are with us. So welcome.
All right. So Katie just went over the agenda. She talked about the Q&A. So again, we're going to hold that until the lash lift treatment. So if you do ask a question during the webinar, we're not ignoring you if we don't answer it. We're just going to wait till the end, okay? All right, so a little bit about me. So I'm Kate Connor, and I've been doing aesthetics for 13 years in the coastal region. I have worked for Dr. Holland for 5 years, and I've worked for plastic surgeons for a while, and I absolutely love this industry. My favorite things to do, I absolutely love, let's see, microdermabrasion, all acne facials, any type of corrective facial. I love educating about skincare, and I'm really happy that you guys are joining us this evening.
And I'm Katie Dion. I have been in the aesthetics industry for 15 years. I have worked in a variety of aspects of skincare and beauty salons. I started with Dr. Holland last year when she first opened. I'm so happy to be here. I love cool sculpting, which we do a ton of here, as well as the facials. The lash lift that we just brought on is such an amazing treatment. And we have great product lines. So I'm happy to be here and teach you about everything we have to offer. Also, just so you know, we are wearing these lovely shirts today to introduce our 90-day challenge. We are working with, let's see here, Dear Go Fitness, Greener Postures Yoga, and Blake Orchard Juicery.
We are so excited.
So excited. Our 90-day challenge starts on the 12th of September, but we are currently in our phase of setting up appointments and getting you these shirts.
And the prize,
yes.
The prize is, I couldn't remember, a $1,500 value for the prize, and it's phenomenal. So I'm really excited, and I think that this is a great opportunity for everybody to join us with our workout routine and see that we are real people and we use the products, we do the yoga, we work out, you know, we drink the smoothies, like we are just as real as everybody else, and we fit it in our day, so we're going to fit it in your day, and it's going to be a great way for us to come together as a group and really be healthy together from the inside out.
And see what, most importantly, it all started with our skincare, and we want you to see that it's so important. Skincare is your first step in any of the procedures that we offer. And even just being on a really good skincare regimen for 90 days is going to make such a huge improvement in your skincare. And we want everyone to see that. And
protecting your investment.
Protect your investment. Yes.
Yes.
And along with the Kates here, we have Mary, who you will see a little later. She has been willing to be our model for the lash lift today. We're very happy to have her here with us.
We're excited.
So, we're excited.
Okay.
All right.
All right. Professional skincare. Ba-boom. All right. Okay, so we do have Skin Medica here. So Skin Medica is a professional medical grade, pharmaceutical grade line. I love using Skin Medica. Skin Medica has been around for many years. TNS, which is one of their major products that they do have, that stands for Total Nutrient Solution. They have patented a growth factor formulation, which they have bottled up, so then you can put it on your lovely skin and you can have brand new skin. Because what your growth factor does is it actually puts together all of your wounded skin and makes it treats it like it's a wound so that you have this nice healthy skin. Okay, so what we do have, what we're promoting here with our Skin Medica products, our hero products. So we have the TNS Essential Serum, which I kind of just talked about. This is actually 8 products in one. It's a bigger bottle. It has antioxidants on one side, and then it has the growth factors on the other side. So I kind of say it's like the Mentadent little toothpaste Mentadent bottle, where they both come out at once. So it's a really great product. This is your green smoothie, is what I say, green smoothie for your skin. We do have the Lytera, which is a 2.0 pigment correcting serum. So this is great for all of your melasma patients, any type of hyperpigmentation, all of your any inflammation that you have from acne that causes pigment. So
hydroquinone free.
Hydroquinone free. So if you have questions about that too with the hydroquinone, that's a good one. While Katie's doing her demo, I can actually compare the two for you because a lot of people do ask me that. So I'm sure that might come up later. What's the difference between your hydroquinone and then your Lytera? So the difference between the prescription and then the over-the-counter. Okay, and then another product that we have, where are you? The HA5. So HA5, this is hyaluronic acid. Hyaluronic acid is 5 times more hydrating than water. So by putting this on your face, we also have this in a lip as well. It makes you have that gorgeous, plumpy, dewy look. Your skin is nice and hydrated, great for the winter, fabulous product. And then another thing we have, of course, which is our SPF. This is the Total Defense and Repair SPF. So not only does this protect, but this repairs your skin at the same time. Great SPF, full of antioxidants. You're kind of getting the double whammy here.
Everyone should have this.
Everybody should have this product.
Men, women, everyone.
It also comes in a tint as well, which we love to use post-procedure. So when someone's all nice and red from whatever laser treatment that we do, whether it's, doesn't matter what it is, we put that tint on there, takes the redness down, you're protected, you look great, you can go back to work. Wonderful product.
And the 50, we have the 50.
Yes, we do have it in 50 as well. Yep, thank you, Kate. Okay, and then the retinol complex, we do have this in 3 different strengths. So everybody knows vitamin A is a must-have for your skin. The vitamin A stimulates your elastin, it stimulates your collagen, it stimulates your exfoliation process. So what we like to have people using for vitamin A's, we can start you at a 0.0 to 5, we have the 0.0, the 0.5, and then we have the 1%. So we can start you small. Katie will also talk about our Environ product, which is a vitamin A product line that has a fabulous step-up program. So she'll go into that, but we highly recommend everybody to be on your vitamin A. We want to not only protect your skin, but we want to repair your skin. We want your skin to be functioning like brand new skin every single day. So your vitamin A is going to help you to minimize your wrinkles, minimize any texture. So any other questions about these products, just make sure that you ask later on and I can fill you in with anything, and we'll have Katie move on with the Environ product.
And just so you also know, if you're unable to make it into the office and you're running low on a product, or even if today you decide that there's something you'd like to try, you can go right on our website, hollandplasticsurgery.com. At the top of the website, there is a shop link, which will direct you to the Skin Medica website, where you can order any products. Your Brilliant Distinction points, if you have those, can be used, and you will get 2-day free shipping to your house, and they include a little free sample, so it's a really nice option.
Great deal.
All right.
Okay.
All right, so Environ Skincare. Environ is a newer line that we brought in a few months ago. We wanted a line to complement Skin Medica, and we tried out a lot of lines, and the Environ is one that we all really loved. We all noticed quick changes from. Environ is all about vitamin A in their products. You can use their products in conjunction with Skin Medica. Their product that they're most well known for is their line of AVST moisturizers. The great thing about AVST, this is a vitamin A product, which your skin loses the vitamin A every time you go out in the sun, but this is very mild. The idea of the step-up system is everybody can start on at least the AVST gel, which is the very lowest. You can even use this on children. It's nice for men with ingrown hairs, children with skin conditions, eczema. But we start you on a low dose, and after you finish each bottle, if you don't have any irritation, you move up to the next level. So you're slowly introducing the vitamin A, vitamin C, and antioxidants into the skin. You can use this product morning and night with no irritation from the sun. You're gonna get a little moisturizer quality from this product, and it's just lovely. It helps with the texture of the skin. It gives you a nice glow. Everybody should be using this for their sunscreen. Another great product from Environ that we're loving is the Revival Mask. This is something you can actually sleep in. So you can use this about 3 times a week. You start with it about 15 to 20 minutes, and then eventually, if you don't have any irritation, you can put this on over top of your ABST, sleep in it, take it off in the morning. Your skin's gonna have a really nice glow. Pigmentation is gonna start to fade. It does have a few acids mixed in it. This is a great product we're all big fans of. And Environ wants to focus on not only the face, but also take the skin down to your whole body. A lot of people deal with sunspots, crepey skin, especially on the arms, the décolleté. So Environ came out with their Dermalac lotion body range. These are 2 separate oils. Your Dermalac lotion is going to be your acid. Your AC and E oil is going to be the hydration. So you want to do, say, one part lotion to 2 parts of the AC and E oil. You can just put a little bit in your hand, rub them together, and then you'll work them right into the skin. It's an oil that absorbs very quickly, so you're not going to be left feeling greasy. It's not going to stain your clothes. And the effects of this product are amazing. You're going to have nice soft skin. It's going to help to tighten. This is one of Dr. Holland's favorite products. And one of the products, as well as the ABST, that made us want to bring this line into the office. This is the Revival Mask that I had mentioned before. Let's see here.
Oh, and that's it for Environ.
I know, that's it for the Environ. We have a great eye treatment from Environ. They have some great cleansers. They have a really nice oil to clay cleanser that you can use the clay for a mask if you have some breakouts, congestion. And yeah, so we're happy to tell you about this in more detail as well during some of our facial treatments or some of the other aesthetic treatments that we offer.
And a lot of people ask about the vitamin A because normally we tell you to put your retinols on at night, where Environ has their retinols the day and night. So if you have any questions about that, I can explain that a little bit more when Katie does her demonstration, because I bet there's a lot of questions about that. Okay. All right, what we offer. So skincare consultations, these are the #1 best things I think that we offer, because when you take the time to come in and you can work with us one-on-one, we can be honest with you about what you need. You can be honest with us about what you need. It's just a really good amount of time where we can break down what it is that you're looking for and what your result wants to be, financially, all that fun stuff. So the skincare consult is really the most important service I feel that we offer, and take advantage of it and give us a call and come in, because it really is helpful and it's a great time.
Yes, and we had a gentleman come in a few months ago who was interested in some tightening. He had never used any skincare products before. He wasn't sure where to start, and we, not to go back to skincare, but we said how important it is to start you on a regimen before we actually move towards a procedure, because we want to have that skin nice and healthy. And he just came back to replenish his items, and he was so impressed with just the improvement he saw from the skincare products. So it's nice to come in for that consult, and we can get you started on the proper path.
It's worth it.
So microderm is one of the treatments we offer. This is a wonderful treatment for after seasons.
Great introduction. We're going to interrupt for a minute. Yes. So this is Dr. Holland. So she is the face of Holland Plastic Surgery and Aesthetics, and she is delighting us with her interruption right now.
Yes, I'm sorry. It was in a procedure next door. I just
Okay.
want to see how it's
It's all
going in
right.
here. So far, so good. Looks like good so far.
Yep. We're happy
On
that
to
you came
skincare?
in.
Yeah.
We're on to skincare, and we discussed Environ and Skin Medica. What's your favorite product?
This is still my favorite product.
Okay, yeah. Yeah, we did mention that. That Dr. Holland loves the Dermalac and the AC&E oil. So.
Good. All right, back to business.
Have fun. Thank you.
Actually, microderm is a great combination with this body treatment. The microderm you can use on your face, It's also a treatment we do as part of our back facial. It's wonderful for after, during season changes to get that buildup of dead skin and buildup of product off. It's just really gonna soften the skin. It's gonna help to minimize fine lines. And when you remove all those dead skin cells, all of your product is going to be able to penetrate much better, and you'll see the effects more rapidly. On the back treatment, this is Dr. Holland's favorite treatment. So back treatment is essentially a facial on the back. We can't see what's happening back there, and you know, we sweat and our clothes rub up against us, and we just get a lot of dead skin and gunk that we can't see and really treat. So that's what makes this a great treatment. It's relaxing, you get a massage, you get that hot steam. We do the microderm, which is gonna help break up those dead skin cells. Do a nice little massage with the Environ body treatment, which you can purchase this to take home as well.
And if we see anything suspicious, you know, because we
Just
can't,
some extractions.
people can't stare at their backs all day and see them. So if we see anything suspicious, you know, like any type of mole or type of anything, we'll let you know. So
Yes.
it's also a 2-in-1 skin check, plus
Exactly.
relaxing treatment. Oh, let's try that again. Okay. So chemical peels. So we love chemical peels. We're huge fans of peeling your skin. We do have this, we have Skin Medica peels. We have 3 different levels of peels. So the Illuminize is your more superficial. We have Vitalize, like more of a medium, and then we have the Rejuvenize. So that being said, each peel actually is able to peel specific layers of your skin. So things happen in different layers of your skin. So where your oil lives, where your pigment lives, all that fun stuff, it's all living in different parts of your skin. So that's the whole point of the peel. So whatever acid blend it may be, wherever it needs to go, whatever level you want to do, wherever that needs to go, peels everything off, and then you build new skin. So great for acne, great for rough texture, great for even there are some rosacea patients as well that can use a nice superficial peel to help kill the bacteria, because bacteria is a huge part of rosacea. So if you have any questions about peels, ask us later on, but come in, try a peel, they're wonderful. Very little downtime, especially the Illuminize goes right on your face, like great after a facial, after a microderm. You can really bundle them together, and peels are really your biggest bang for your buck because the turnaround time is a really, really short time, and so you can see a huge difference in a really short period, and then you can get them a few times a year. So they really are the biggest bang for your buck, keeping your skin nice and fresh and nice and clean. So any other questions, you can ask me about that later.
Yes, just some.
Yep, so here are some photos. So your Vitalize peel here, which is on my left, you can see all that clogging, all that acne. And then after 2 peels, how it's mostly gone. So the Rejuvenize peel, that's a great picture there because it shows all that texture, all that deep texture, and all that kind of like those, we say little craters, which isn't really the most professional word, but when people call, that's what they say. And you can see on the picture there how it's really cleared up and really toned out.
The Revitalize peel is the strongest of the 3 peels that we offer. But people always ask what to expect, and it's sort of, if someone's never had a peel before, it's sort of hard to understand or, you know, grasp what exactly they should expect to see. So this is myself after a peel. The day of, you're just gonna be glowy. The next day, you're gonna, again, the skin's gonna seem nice and tight and glowy. The following day is when you'll start to peel. Typically, it'll start right around the mouth and the chin, and then it will make its way to the hairline. So you can experience that peeling anywhere from 2 to 5 days. The HA5, which Kate mentioned in the beginning, the hyaluronic acid is really nice to put on. You can put that on in the morning and then sort of pat that on throughout the day if that flaking is sort of bothersome.
Those are great.
And facials. So our facials, we offer customized facials. All of them are, we bring you in, we talk about what exactly results you'd like to see, what's bothering you, and we will pick out the proper products to achieve those results for you. We have a vitamin C treatment we can offer. We can add the microderm as part of your facial. So we can help with acne, and you come in, we make you nice and comfortable. There's some nice steam, you'll get a massage. So it's relaxation as well as you'll leave looking fantastic.
So relaxing, so good. We love doing them. And with facials, you can also add microderms to facials, you can add peels to facials. So that's another thing to think about. When you do come in for your facial and you're wondering about other things that you can add, ask us about that because there's many things we can do.
And there's a lot of other treatments too that we didn't touch on today, lasers and Infinity, that's a webinar for another day, but all of those things we can do in conjunction with our facial.
All right, brows, lashes, and more. So right here we have some photos of brow wax with tinting. So you can see myself, the before and after. And then we have brow wax with shaping. So you can see there on the left how some little stragglers and then cleaned them up and shaped them nicely. Really open up the eye. And then we also have a brow wax and brow and lash tint. So we do offer that as well as a lash lift.
Yes.
So I go into that, but
let's get started
on the lash lift. So I won't go into it.
So we just started offering the Elevana Lash Lift. It's a great treatment. It lasts about 6 to 8 weeks. And the treatment's only about 45 minutes, so we can do it with or without a tint. On the screen here, we have the instructions for the procedure, but it's pretty simple. And I'm gonna come over here and get started with Mary. No mascara. She's going to make sure she doesn't wear any mascara, no eye cream for the next 12 to 24 hours. Stay away from steam, no showering, no cooking over a hot stove. I'm sure she's really bummed about that.
So sad.
Just put my hands here. Great. Let's see. All right, so Mary had a brow wax yesterday, so they're looking fantastic. They'll complement her lashes nicely. She has very pretty lashes. Let's see here. So I'm just gonna have you close your eyes for me. And first, what I'm gonna do, we have these silicone rods that we wrap the lashes around. So I just wanna figure out what size rod we'll need. So I just put the lash right up over here. Perfect. And down here. Going to put a little protection over her bottom lashes so I don't get those in with the top. If you can open and look up for me. Perfect. And I've asked Mary prior if she has any reactions to any adhesives. And I checked to make sure she doesn't have contacts in. You can wear contacts, but some people, it's a little bothersome to have their eyes worked on when they have contacts in. Mary has really nice dark lashes, so we're not going to be tinting, we're just going to be doing the lift. You can wear mascara over top of this. You can still use Latisse if you're a Latisse user. Just again, you want to wait 24 hours. So this is just a little glue. Get that nice and close to the lash line. All right, now we're going to wrap the lashes around the rod. If anything's going to be uncomfortable during this procedure, this would be bothersome. And this is the most time-consuming part of the treatment. You really want to make sure the lashes are perfectly placed. Mary's lashes are a little coarse. They are not wanting to behave, but that's okay. We'll get them there. There are some short ones in there, so your eyelashes, all hair goes through 3 stages of growth. And some of the short ones might be breakage, or they might just be new lashes growing in. If anyone has any questions while I'm doing this, feel free to send questions along. This is really a great treatment if you're going on vacation. It's nice for a special occasion. Or really, I just think it's nice when you wake up in the morning and look in the mirror and you have pretty lashes. Do you use eyelash curling?
No, I do not.
Okay.
I did back in the day.
So you can probably see some of these, there's some short ones down here that don't necessarily want to cooperate, but I'll get them on there. There we go. This, I'm just getting that rod down there. Doing okay, Mary?
I'm doing fine, Katie.
Good. So I'm going to come back after I do this eye and put a little more glue on those lashes, the ones that are wanting to misbehave. And if anyone's ever had lash extensions, this procedure is much less tedious. You don't have to have your lashes, the extensions falling out. It doesn't take as long. Kate was a lash extension patient, and we've converted her. While we're doing this, I'll take a moment to let everyone know or remind everyone about our open house, which is September 5th. It's going to be really fun. We're going to be doing another lash lift demonstration. There's going to be a bunch of giveaways. We'll have snacks. It'll be a great party. So give us a call and get on the guest list. Right now I'm just making sure I don't have any bottom lashes that are making their way to the top. Anyone having any questions about the procedure or skincare? Let's go back here and get a little more on these. Some of these hairs are a little short, as I mentioned before. They might just be some new growth, so they might not. It might be a little short to wrap around the rod.
the majority of the hairs are nicely around there. So I just want to make sure one more time before I put the lift lotion on that everything is nice and straight, because that is the way the hairs will set. This process is very important. Right. You're still doing well?
I'm doing just fine.
Okay, great.
Very relaxing.
All right, so we're going to start with our lift lotion here. Ashley, would you actually mind running in the next door room and getting me a timer, please? It is attached to the microderm machine. So I'm going to put our lip lotion on here. Thank you. You having any irritation at all?
No,
Good.
not at all.
Great. Make sure you nicely coat the lashes. Okay, great. So it's going to sit on for about 6 minutes. All right. Just going to be sure that there's no solution at the very ends of her lash. Just do a little wipe there at the tips. Looks good. Great. If anyone has any questions, please feel free to ask anything about any of our services we spoke about earlier, any of the products. If you have any questions for Mary. Any irritation at all? No. Fantastic. We just have a little over 3 minutes left. What can we talk about? Let's talk about
Let's
something.
talk about
Let's
something.
talk about the difference. Oh, that's right.
Or vitamin A. Do you want to tell people
Yeah,
more about
let's
vitamin
talk
A?
about vitamin A and why Environ has a daytime vitamin A when we are always telling our patients, be careful, don't put your vitamin A on during the day because number one, you're more sensitive to the sun. And then also the sun breaks down most formulations of vitamin A. So the form of vitamin A that our body uses is actually tretinoin, which is retinoic acid. So there's all these forms of vitamin A that our bodies have to use and have to turn into retinoic acid. So it converts it into retinoic acid in order to use it. So that being said, when you get a prescription for tretinoin, that is retinoic acid, and that is the purest, highest form, I should say, of vitamin A. So Environ has formulations that, number one, they do not get broken down by the sun. So retinol palmitate is one of them. So you can use that during the day. The sun will not break it down. It will actually repair your skin, help to strengthen your skin at the same time, and then also help to protect your skin. So you can still use your retinols. It's another question that I've had many times. Can you use your retinols with Environ? Yes, you can. So you can use your Environ, the ABST steps, morning and night, plus your retinol, whether it's a 0.05, 1%, whichever it may be, at night on top of or under your ABST moisturizer. You can also use your tretinoin as well. So it's never a bad thing to have too much vitamin A. There is no such thing of having too much vitamin A on your skin. Just making sure that you have your SPF in there. Environ does have one SPF. Skin Medica has a few other SPFs. So the AVST, the Step Up program, you would need to make sure that you do have an SPF on your skin every single day after you apply that moisturizer. Let's see, what else? That's vitamin A. Antioxidants, people ask us all the time, why do you need antioxidants? Like that's and peptides. Yep, so that's your green smoothie for your skin. So we go to the gym, we work out, we eat all these wonderful fruits and vegetables that we put into our body. Why would you want to put that on your skin, right? So that makes sense. So making sure that we're checking off all the boxes, putting all that vitamin C, all those nutrients, all those peptides into your skin so that you're stimulating those fibroblasts. Your fibroblasts are what help you to they actually produce your collagen, produce your elastin. So making sure that you're feeding them everything that they need to be fed so that they can function at a proper functioning rate, so that we have young, beautiful looking skin. What else?
That's the goal.
Yeah, that's the goal. Yes, that is the goal.
And the TNS is such a great product from SkinMedica because it has all of those antioxidants, peptides, serums, all in one product. So instead of buying 5 different serums, you're getting all of those things in one bottle.
In one bottle, the magic bottle. All right, so I'll let Katie get back to it. So right now I'm just taking off the lift lotion. Doing okay?
Mm-hmm.
Now we're going to put on the setting lotion. It's kind of like that old-fashioned perm. I'm sure we've all had the bad perm at some time in our life.
You bet.
Mm-hmm.
1982.
Yes. I had mine in 6th grade. I remember showing up to lunch and everyone saying, "What happened to your hair? Why do you look like a poodle?"
The way to be.
Yep. A little more on there.
I wonder like Barbra Streisand.
Oh, yes. Well, she had curly hair. She has
That's
curly
right.
hair.
And then Star is Born, right?
I liked her in Fun Girl.
Mm-hmm.
Right. Right, so I'm going to set another timer for 5 minutes. And then after the 5 minutes, we'll take everything off and she will have beautiful lashes. Hopefully she has some hot plans this weekend.
Not really, but thanks.
You might after this.
I mean, that's true.
If anyone has any questions about the 90-day challenge, feel free to ask about that as well. There's a whole lot of information we gave you about that, so you may have some questions. And it's such an amazing deal. I think the skincare alone is a value of almost $1,000. We have 3 peels you get in there with microderm. So the treatments that we spoke about today, with the fitness classes, we're going to be right there doing them with you. I don't know if anyone's been to Blake Orchard Juicery in
Portland, but
We love
their
it.
juices
Yum,
and
yum.
bowls
So
are
good.
delicious.
Yes.
Their smoothie bowls.
Oh, yes. And then the winner gets a month's workout, semi-private at Deergo, more skincare products from us. It's a $1,500 value. They get a juice cleanse from Blake Orchard, a yoga pass.
Awesome.
Got my mess here. And if anybody is a listener of the radio station 97.9, you will have to be listening for our commercials. Holland Plastic Surgery just started being advertised on that station, which is pretty exciting.
Mhm.
Pay attention.
You'll hear Lori and Sarah hang out.
Yes.
Mm-hmm.
I think they drank champagne together and had cupcakes or something
Something.
fun.
Sounds perfect.
Yes.
Champagne and coffee.
Yes. We just have a little over a minute left.
So I have a question. If the solution were to get in the eye,
Yes.
does it burn? Is it hazardous? Like, can you just wash it out?
You can. It might just be a little bit of a discomfort, a little bit of a tingling sensation, but we can just rinse it with water and the irritation will subside
Okay.
quickly.
And if somebody needed to use the bathroom during the treatment?
Well, then they just have to hold it, I'm sorry to say.
Okay, okay.
There's no getting up walking around with these on
There's
your
no
eyes.
getting up. It's a pretty quick treatment, so I
That's
think,
the positive about this, the difference between this and the extensions, because
Yes.
the extensions can be sometimes 2 hours.
right.
So sometimes you're really dying if you have to go to the bathroom.
Yes, follow-up care, as I mentioned before, you just want to make sure you stay away from heat, nothing, no steam, no saunas, no shower. You don't want to wash your face for the next 12 to 24 hours. You can use a washcloth, but no direct water. No oils or creams around the eye area, no mascara, no Latisse, just for 24 hours. Then you can resume all normal activity. We really advise you to stop put your eyelash curlers down. This can just result in breakage of the lashes. And once you have your lift, there's no need for a lash curler. But yeah, there's not too much you have to avoid. Here we go. Our timer is up. So now the big reveal. Just want to gently remove the product. Just working the eyelashes off the rod. Water removes all the glue. Doing okay?
I am fine.
Good, good, good. This is a nice little way to treat yourself.
It's relaxing.
Mm-hmm.
Those lashes are happy to stay right where they are. Happy. This is Mary's very first eyelash lift, so I'm excited to see what she thinks about the results.
I just have to be here every day.
Mm-hmm. Remove the eye pads. They're looking beautiful. Don't open your eyes yet.
I won't.
Take a little pad and make sure all of the glue has been removed, all of the processing solution. So now I'm just going to take a little fan and make sure they're nice and dry. Because water is our enemy here for the next 12 to 24 hours. Really, really pretty.
Now, if you were to tint, when would you tint? Like after?
Yep,
Yeah,
after.
yeah.
Yep. That's a great question. Yep. And the tint does not last as long as the lift. The tint lasts for about 3 weeks, 3 to 4 weeks.
Same as the like eyebrow tint too.
Exactly.
Yeah.
Yep.
I gotta say, I love the webinars.
Oh,
I
thank
do
you.
because I like to see all the different procedures, and as a patient here, it's fun.
Let's see. I'm going to have you open up. Everything feel good?
Yeah.
Right. I'm going to give Mary a mirror here so she can see the finished results.
Up close and personal here. Oh yeah. Wow, that's good.
I'm going to sit her up a little bit so she can get a better look, as well as everybody on the webinar can
Yeah.
get a nice look.
Could have taken a nap.
See, it's that relaxing.
That relaxing. That's awesome.
Yeah,
Awesome.
beautiful.
Yeah.
Thank you.
Thank you.
Thank you for joining us. If anyone has any final questions or comments, please let us know.
It was easy, just to tell you.
Thank you for joining us.
Thank you for joining us again. Please give us a call.
Sign
Get on
up.
the RSVP list for the open house on September 5th. Sign up for our 90-day challenge, and we will see you on our next webinar.
Thank you so much.
Bye.